Well, word now coming to hand that there are 32 positive cases as at 5:53 p.m. today from samples taken during the period July 30th, 2020 to August 5th. Therefore, this figure is not representative of the positive cases over the last 24 hours only. 11 persons have tested positive for the COVID-19 virus in the last 24 hours. 18 are contacts of recently positive COVID-19 patients, and 14 cases are pending epidemiological investigation. All established protocols have been implemented. This puts the country now at 275 cases, with 50 of these cases being announced today. Well, a new system for receiving COVID-19 test results has resulted in a delay in reporting this country's positive cases. The latest development has caused the Chief Medical Officer to remind members of the public to adhere to self-quarantine protocols once they have been swabbed for the virus. Crystal Wilson tells us more.
The Ministry of Health's COVID-19 update on the morning of August 8th took a bit of a different turn, as the clinical update this time included test results of cases as far back as July 31st. Chief Medical Officer Dr. Roshan Parasram referred to the latest trend as unfortunate. He explained that swabs for testing are first sent to the Trinidad Public Health Lab, and for quality control purposes, the swabs are then sent to the Caribbean Public Health Agency. Dr. Parasram said within the last few days, positive test results are being batched, thereby changing the daily updates received by the Ministry of Health. Now that the results are grouped, Dr. Parasram said this has caused a delay in updating the daily statistics.
Now I am receiving, for over about 5 or 7 days, a lag of 7 days. In terms of the reporting, we're seeing batching of the positive tests, which gives a sort of an artifactual epidemiological picture of what is really happening.
According to Dr. Parasram, this country is now experiencing its second phase of the COVID-19 pandemic. And now, with a delay in receiving test results for persons suspected of having the virus, he said obeying self-quarantine protocols is imperative to preventing the spread of the virus.
Once you have a swab for COVID-19, that you await the negative result before you continue on. And even if you don't have COVID-19 and you have a viral illness of some type, we want to reduce the risk of any virus spreading in the country, and the same remains. You don't go to work ill, you don't go to school ill.
Dr. Parasram said the age group most affected by COVID-19 in this second phase is between 20 and 40 years old. Asked whether there is any connection to younger COVID-positive patients to the recent reopening of bars, the CMO said data so far suggests this might be true.
There have been established links to bars in a number of cases where we saw positive cases being at bars. Still to be determined whether they would have picked it up from any interaction with the staff there or any other patron there. So that connection has to be made. But there's certainly a link between the attendance of bars of more than one individual, recent attendance, and their positivity.
Crystal Wilson, TTT News.
Well, Communications Minister Donna Cox is reminding members of the public to adhere to COVID-19 public health guidelines in order to prevent the spread of the virus. Ms. Cox was speaking during the Ministry of Health's COVID-19 virtual media conference on Saturday and said with at least 3 bars referenced in the Health Ministry's contact tracing exercise recently as being visited by COVID-positive patients, she noted that COVID-19 prevention measures are important and can save the population once followed.
And as we go, I would like to appeal to those who are liming and socializing in public spaces to please observe the public health guidelines. As you know, 2 or 3 bars are now connected to active COVID-19 cases, which also contributed to the outward spiral of the virus from a primary contact into public spaces. What this means is that we are not following the simple but effective public health guidelines meant to protect us. This action of daring poses a threat to all.